everybody should be insured. It would be great to have a public option and to have Medicare be expanded to people, but that doesn't solve the problem unto itself. And the more that we say Medicare for all, but don't actually look at the full system and say, how do we get costs down as well? Then it doesn't matter because the payments that we have with Medicare will never match the costs.
How do we bring the costs down? Outside of labor expenses, which can fluctuate because people want raises, right? Doctors want to be able to pay for the education, right? So take labor expenses out, which I think can fluctuate depending on years of service, things of that nature. There are fixed costs, right? There are the cost for items that are used within the hospital. There's the facilities themselves. When you look at that, how do you keep the cost down?
May I talk about labor first? Doctor payments from Medicare have been pretty much flat. They raise at 1-2% a year, sometimes have dipped. And this Republican Congress last year got a dip in the amount of payment that doctors get from Medicare. Whereas hospital payments have risen, but even more so, the money that goes to insurers through Medicare Advantage has risen, and other things get risen. That's simply because of a law that's in place of how payments get adjusted. Not only that, but nurses are treated as a cost, not as a value driver, not as revenue. I'm a doctor. I see a patient, I get paid, and the hospital gets paid because I did it. I'm a nurse. I see a patient. The hospital loses money because the nurse spent time with that patient. There's no value for it. There's no reward to hospitals or other healthcare institutions for bringing appropriate or more nursing care to the bedside. And nurses are the most valuable people to the experience of the system. And so there are easy fixes there to change that, such as, hey, I'm not going to pay you, hospital, if you don't have the nursing patient ratios that are of high quality, right? It's just that easy. And so you can change it so that nurses are made to feel valuable in the system and are revenue producing.